Do you feel your muscles getting weaker faster these days? Waking up tired, finding it harder to sit down and stand up than before? I'm Dr. Name, and today I want to speak with you the way I'd speak with a patient in my clinic. Every night, your body runs a natural repair shift. During deep sleep, your brain and muscles send signals to mend tissue, synthesize protein, and reset energy systems. If we support that shift at the right time, we can make it work better. If we use the wrong things at the wrong time, we unintentionally interrupt it. Before we get specific, let me be clear. This is general health education, not individualized medical advice. If you're taking medications, have kidney, liver, bleeding, or endocrine conditions, or are pregnant or breastfeeding, please talk to your own clinician before starting any supplement. Our goal isn't the more the better, but right form, right dose, right timing to elevate sleep quality and help your muscles recover naturally. I want you to picture an ideal evening. Dinner finishes 2 to 3 hours before bedtime. You dim screens 30 to 60 minutes earlier than usual. The bedroom is cool and dark, no caffeine after the afternoon. On top of that foundation, we add a few small but strategic nutrition pieces. The first piece is magnesium glycinate taken 30 to 60 minutes before bed. Magnesium participates in hundreds of reactions in the body, especially in muscle, from relaxing muscle fibers to producing ATP, the energy currency cells spend to repair. The glycinate form absorbs well and is gentle on the stomach. The accompanying glycine also tends to deepen sleep. You can start at 200 to 300 milligrams, about 40 to 60 milligrams elemental magnesium, increasing to 300 to 400 milligrams if sleep and digestion remain comfortable. Avoid oxide, poor absorption, and be cautious with citrate at night because it can loosen stools. For many of my older patients, simply choosing the right form and timing of magnesium reduces nighttime cramps and smooths out sleep, and uninterrupted sleep is the condition muscles need to repair. The second piece is vitamin D3 together with K2, MK7, taken with dinner that includes some healthy fat for absorption. Vitamin D insufficiency is common in older adults, especially in rainy/cold seasons or with limited sun. Adequate D status often tracks with better muscle function and balance. But because D3 increases calcium absorption, we pair it with K2MK7, the traffic director, that helps usher calcium into bone instead of soft tissues. A commonly used reference dose is D3 2000 to 4000 IU plus K, 2MK, 7 100 to 200 micrograms. Important note, if you take warfarin or other vitamin K-affected anticoagulants, ask your prescriber first. Sometimes K2 must be adjusted or avoided. Another advantage, evening magnesium helps your body activate vitamin D. Placing D3 at dinner and magnesium at bedtime often makes that chain run more smoothly. The third piece is zinc in the picolinate form, taken about 30 minutes before sleep, and not with calcium, iron, or copper, because they compete for absorption. Zinc is involved in protein metabolism, immune function, and serves as a cofactor for many enzymes related to tissue repair. In some older adults, a quiet zinc deficiency develops due to limited diet variety or reduced absorption. Supplementing correctly can improve day-to-day recovery. A typical dose is 15 to 30 milligrams zinc picolinate. If you feel a bit queasy, lower the dose or take it with a small snack. Most people acclimate within a few days. The fourth piece is vitamin B6 in the active P5P, pyridoxal 5-phosphate, form, taken with your magnesium. Unlike regular B6 that needs liver conversion, P5P is ready to use for amino acid and neurotransmitter metabolism, the steps that turn the protein you ate during the day into the raw materials your muscles need at night. Some patients report calmer, more continuous sleep and clearer dreams with P5P, often a sign of a more balanced sleep architecture. Common dosing is 25 to 50 milligrams P5P. There are two things I prefer to move to morning, so they don't disrupt sleep. First, vitamin B12 or B complex. For many people, B vitamins are alerting, great in the morning, not great at night. So keep B12/B complex before noon to protect sleep. Second, high-dose vitamin C. Taking C near bedtime can increase nighttime urination for some people. And C can also interfere with the separate timing we want for zinc at night. I usually suggest splitting vitamin C between breakfast and lunch. Now let's assemble an easy schedule you can put on your fridge. With dinner, 2 to 3 hours before bed. D3 2000 to 4000 IU plus K2 MK 7 100 to 200 micrograms with a bit of healthy fat. 30 to 60 minutes before bed with water. Magnesium Glycinate 200 to 400 milligrams plus P5P 25 to 50 milligrams plus Zinc Picolinate 15 to 30 milligrams. Morning, B12/B complex, vitamin C, split morning midday. Don't take zinc with calcium/iron/copper. Avoid coffee and alcohol close to your nighttime supplements because they affect absorption and sleep quality. You might ask, how long until I notice change? In my clinical experience, week 1, many people sleep deeper and have fewer nighttime cramps. After 2 to 3 weeks, morning stiffness and baseline fatigue ease. From week 4 onward, everyday tasks, carrying things, climbing a few steps, standing up without pushing off, feel lighter. And by 8 to 12 weeks, if you also meet protein needs, walk regularly, and add light resistance work 2 to 3 times per week, you'll feel noticeably steadier and stronger. I always remind patients, supplements are leverage, but the foundation is consistent bedtime, protein evenly spaced through the day, for example, 25 to 35 grams per main meal, appropriate movement, and adequate fluids. There are a few common mistakes I want you to avoid. One is taking everything at once. That invites absorption conflicts and overstimulation. 2 is choosing the wrong forms. Magnesium should be glycinate, zinc, picolinate, K2, MK7, B6, P5P. 3 is raising doses too fast. Start low, observe for 1 to 2 weeks, then adjust. Our targets are better sleep and a calm stomach. 4 is forgetting medication interactions. If you're on anticoagulants, diabetes meds, blood pressure meds, thyroid meds, or have kidney-liver disease, loop in your prescribing clinician to adjust safely. 5 is expecting overnight results. Your repair systems need time and consistency. I also want you to track a few simple markers each morning: sleep quality, 0 to 10, number of awakenings, morning energy, and a small functional test such as timing how long it takes to stand from a chair 10 times. That little log helps you and me, or your own doctor, tune doses. Some folks do best with 300 milligrams magnesium instead of 400 milligrams. Some need only 15 milligrams zinc. If you're starting tonight, start simple. Move B12 and vitamin C to the morning. Add low-dose magnesium glycinate before bed. Put D3+K2 at dinner. See how your body responds. After 5 to 7 days, if sleep is good and your stomach is comfortable, add P5P. A week later, add zinc. This stepwise approach lets you see exactly what's helping and prevents overload. Finally, if you're discouraged by years of feeling yourself get weaker, hear this from a physician who has worked with many middle-aged and older adults. Age-related muscle loss is common, but it isn't destiny. We can slow it, and even reverse some of it, with sustainable, smart habits. Every good night of sleep is a night when the repair shop in your body has the lights on, the materials ready, and enough time to work. Every morning you wake up feeling a little lighter is proof. Tonight, give your body those conditions: a tidy dinner, a few supplements in the right forms at the right times, and an uninterrupted sleep. Tomorrow, we follow through. A 20-minute walk in soft daylight, a protein-rich breakfast, steady hydration. If you want me to personalize doses, check medication interactions, or build you a 10-minute-a-day resistance plan, I'm happy to help. For now, dim the lights, cool the room, and give your muscles a peaceful night to recover. We'll meet the next day with steadier legs and stronger hands starting tonight.